Nurse Alice Benjamin is with us again tonight with more on the president's diagnosis. Nurse Alice, the president's doctor released that statement tonight saying the president is not on supplemental oxygen, but they've elected to initiate Remdesivir therapy at Walter Reed. What do we know about this therapy?
Well, I'll just say this first. For the president to not be on oxygen, that's a good thing. What we do know about Remdesivir is that it's a powerful antiviral medication that's typically not given to people until they've been hospitalized and have severe COVID-19 symptoms. And so for the president to receive this medication leads one to wonder, what are the president's real symptoms, and are we really giving this prophylactically when there really isn't any research to support that? It's given once someone has COVID-19 severe symptoms, and it's meant to decrease the severity of the symptoms. But again, someone who has severe symptoms, that's what we typically reserve that medication for. So for the president to receive that now just leaves us some room to wonder as to what his other symptoms may be.
Now, we've heard of several more people around the president testing positive. If someone has a negative test, though, are they out of the woods? How far back in terms of days will they have to trace? You've mentioned the super spreader events before.
Yes. So it's important to know that the incubation period is anywhere from 2 to 14 days. So you have that amount of time before symptoms start to spread. And so when you take a test, the test is good for that day, depending that you've quarantined yourself. But if you've been in contact with President Trump, anyone in that environment needs to quarantine themselves and wait 14 days to make sure that they've not developed any symptoms, because even if they've not developed symptoms, they still may be infectious. And when we're looking at super spreader events, so you can look here at this ceremony. I mean, they're outdoors, which is a good thing. However, these folks are not wearing masks. They're talking. They're closer than 6 feet. And these droplets are still spreading amongst one another. So this event can be considered a super spreader event. All it takes is one person to be infectious with COVID-19 to infect everyone that's an attendee.
You're right. Very few people in that crowd at the Rose Garden wearing masks. You mentioned masks. Let's take a look at this. This is from September 14th. It actually shows Trump administration's Hope Hicks on the left here, seated across from the president. This is inside Marine One, a tight space as it lands on the South Lawn at the White House. She's wearing a mask. He is not. Now, what goes through your mind when you see this?
I see a missed opportunity and the opportunity for infection, because while the one individual is wearing a mask, that's helpful. But just like two heads are better than one, two masks are better than one. And they're sitting in close proximity, and droplets are still able to get beyond the cloth masks. Remember, these are not N95 masks. So there is still the potential for droplets to get through those masks. So what should have occurred here is the president should have been further away from her and should have also been wearing a mask, because I look at this and I look at potential infection on the rise.
Very quickly, Nurse Alice, yes or no on this? Fact or fiction? I've had people ask this question on social media today. If you get a flu shot, could that make you test positive for COVID?
Absolutely not. Fiction, fiction, fiction. There's no relation between the two. And I know some people are hesitant to get the flu shot, but I want to encourage people, especially with COVID-19 here, it's going to be very important that people get their flu shot in addition to still wearing your masks, washing your hands, social distancing, and all of those things to prevent yourself from getting any type of respiratory illness, whether it's the flu, whether it's COVID-19, or whether it's the standard cold. We need to be extra cautious as we enter in these fall and winter months.
All right, Nurse Alice, once again, thank you for your insight. Thanks for joining us. We also want to just let you know there is news about the First Lady tonight as well. First Lady says she is home at the White House and she is experiencing mild symptoms.
Back here in Southern California.